Hi, my name is Martine, and today I want to discuss with you the relationship between diabetes and periodontal disease. But before I do that, I want to explain to you what diabetes is. So, diabetes is a disease in which the body ability to produce or respond to hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated level of glucose in the blood and urine. With diabetes, your body does not make enough insulin or can't use it as well as it should. So, how does diabetes go hand in hand with periodontal disease? Well, a study have shown that there's a relationship between diabetes and periodontal disease. People who have diabetes know that the disease can harm their eyes, nerves, kidneys, heart, and other important systems in the body, but they're not aware that it can cause problems in the mouth. People with diabetes have higher chances of having periodontal disease because diabetes slows down healing. It can also interfere with the treatment of periodontal disease. So, what are some other things that can take place inside the mouth when you have diabetes? Um, some of the things that can take place is dry mouth. Dry mouth can cause soreness, ulcers, and infection and tooth decay. And it can also cause fungal infection. Diabetes may also cause the level of sugar in the mouth to increase. So there was a study done on 1,500 patients with diabetes, and they were out of the 1,500 patients, they were male and female, and what they took into consideration when they analyzed this 1,500 groups of people, 1,500 people, they took into consideration the relationship between the prevalence and severity of periodontal disease and the various other factors such as age, sex, glycemic status, and duration of diabetes. So was 750 males, 749 females, and their age range from 15 to 76. So once the study was done, the results indicated that the prevalence of periodontal disease in diabetic patients was at 86.8%. So, what can we do in on our part as far as clinicians to aid people with diabetes not to get into the part where they're being infected by periodontal disease? Or if they are, what can we do to help manage it? Well, we know we can give them periodontal therapy such as SRP which can improve insulin sensitivity and eventually lead to improved glycemic control and overall outcome of diabetes. Another thing we can do is ask questions, kind of like interviewing the patient, so we can um, assess the patient by asking the patient on what type of diabetes that they have, uh, and are they keeping it under control, and how long have they had it, and have they ever experienced any complications. And we can also discuss with them the importance of keeping their diabetes under control and explain to them also how it relates, how diabetes can lead to periodontal disease such as periodontitis, because the fact that people with periodontitis do have a harder time with healing. And another thing we can do, we can play an active part as far as monitoring their glucose level when they come in, um, making sure where it needs to be, making sure they eat before their appointment, and also communicate with the patient's physician and adjusting the frequency of their dental visit. So we can conclude that when a person has a diabetic person has poor glycemic control, it can increase the risk and severity of periodontal disease. It is important for the us as clinicians to educate the patient of possible impacts of periodontal infection. Patients should also be informed about any other oral conditions that can occur if glucose level is left uncontrolled, such as xerostomia, fungal infection, and the slow healing process after periodontal therapy. This concludes my presentation.